Welcome back to the Futurist New Deal podcast, a very special episode. I'm here with Ira Pastor, and we're going to talk about his incredible chapter in the Transhumanist Handbook. And that chapter is titled Harnessing Nature's Clues for Regeneration, Disease Reversion, and Rejuvenation. A really fascinating subject, and I'm really interested in picking his brain on the subjects more generally around emerging biomedicine and life extension. Welcome, Ira. Thanks for doing this.
Thanks for having me. It's a great pleasure.
Yeah. So this is, as I mentioned, this is also for the companion piece to the Transhumanist Handbook, getting as many authors as we can before in a timely fashion. And so thank you again for doing this. Give us a little bit of an outline of your chapter and the messages that you wanted to bring across in that.
Yeah, absolutely. So, I mean, the core message is that this planet has been here for a few billion years, and there's quite a few organisms around that have been here a lot longer than we have that have, let's say, solved a lot of the problems, whether they have to do with disease or aging or radical longevity, that we're looking to solve. And if we want to solve some of these problems for humans, there is a long history of creatures and their requisite capabilities that we can learn from for realizing, as I say in the chapter, sort of the transhuman, ideal of radical life extension, and whether we're talking about the regenerative capabilities of the amphibians or the cancer reversion capabilities of planarians, or even the ability to turn back biologic time found in many hydrozoan organisms. These capabilities exist, and while we physiologically as humans are, we think of ourselves a little different than the jellyfish or the salamander, at the end of the day, genetically, strangely enough, we're pretty similar. And if we can study those clues, understand sort of why they're capable of doing what they're doing, we will be able to realize truly amazing things for the human condition moving forward.
And I think some people, maybe staunch humanists, might be a little surprised or taken aback with this idea that the human body is not the perfect engineering marvel that they sometimes imagine. But there's a lot of things that we can be doing, and that you have done. This is not a mere thought exercise. You're doing this work, and it's incredible work. And I think it's nothing short of viewed as nothing short of heroic to people in our community, and as well in the transhumanist organizations. So thinking about these ideas of tissue engineering and tissue regeneration, what are some near-term advantages that we can hope to see? Why is this kind of regeneration important, and other interventions of this kind?
Well, there are 5 major forms of regeneration that exist in nature. We as humans have 3 of them. So, we have a physiological turnover, which, think of your hair, your skin cells, your blood. We have a minor regenerative capability in our liver after acute damage, where the liver will grow in size and cell count to sort of take over missing function. And then we have this wonderful wound healing response. We are a species that we bleed very rapidly and we die very rapidly from loss of blood. So evolution and nature has sort of granted us with an excellent ability to heal wounds. What we do not have are the epimorphic and morpholactic regenerative capabilities of some of the organisms I talked about, where we're talking about recapitulation of complex body segments, limbs, whole organs after damage. And this is something that we can get in the discussion of sort of evolutionary why this is the case. But while we're biased towards wound healing, we lost the ability through evolution and so forth to come up with the really complex forms of regeneration required in things like traumatic brain injury and heart disease and spinal cord injury. That little salamander, when its spinal cord is severed, 2 weeks later it's not paralyzed and it's walking around very happily with a newly connected spinal cord. We're in a wheelchair the rest of our lives. So, I mean, the really big things that you can think about in a science fiction context these pieces are capable of doing. And it's not just the spinal cord, it's limbs, it's eyeballs, it's major parts of the heart. It's in some cases entire brains that these species are capable of. And so, think about what that means for any chronic disease or acute disease. So, I mean, we talk about, usually the 100,000 people or so we lose every day on this planet from aging. We also lose an additional 50,000 every day from acute trauma. Put that all together, around 160,000 people we lose from this planet every day. And if we had these capabilities, we can harness these capabilities and tap into them. That wipes out, with the exception of your infectious diseases, it wipes out almost everything that we are spending $7 trillion a year on, throwing sort of treatments at that don't do much in terms of cure. So the potential is truly amazing if we could harness these abilities through the tools of biotech.
Mm-hmm. Yes, and that $7 trillion, it really does tend to get shifted into end of life concerns. And by shifting that into a prevention and oversight at an early stage, we can get a lot more bang for our buck. Yeah. I think people who are familiar with your work should already have an idea of this, but let's lay it out for everyone who might be listening. Are these kind of interventions, is this something like a gene therapy that I could be doing in a few years? Or is this something that's tending to be more limited to something like germline changes for our children for future generations?
Yeah, it's a great question. We made the decision when we started this company several years ago that we understood that our market for what we'll call regeneration and disease reversion is 7 billion people. It's not a small niche. So it made no sense to develop a technology that only a couple hundred people could afford. So we have, when we talk about our company, we're using 20th century technology for 21st century purposes. When we say 20th century technology, everything that we're dealing with is traditional biologic technology, proteins, peptides, microRNAs, stuff that's been around the last almost 100 years now and used in the pharmaceutical industry. We're doing no gene editing, no gene therapy, no chimera production, no cloning, nothing of that nature. So everything, if a vaccine is affordable nowadays, if a therapeutic protein is affordable, your interferons, insulin, and so forth, our products will be affordable. So the concept, utilize what we know in terms of bioproducts, utilize what we know in terms of regulatory pathways for these bioproducts, which are already in existence. We don't have to come up with new regulations to satisfy FDA at some point. And ultimately, 7 billion people become our market and not a few people that can afford a $2 million shot. Mm-hmm. So we're pretty confident and happy with the path that we took on that front because of these factors.
Mm-hmm. And you mentioned this 7 billion person market, not a niche market. And yeah. I think also in that discussion, people, you've worked in a lot of different kinds of types of pharmaceutical development, a lot of different organizations, mm-hmm. and maybe without getting too specific, there's kind of an urban legend around this, and maybe it's only partly an urban legend. Wherein people sometimes express a concern that some of these organizations are more interested in developing repeat customers than in finding cures for these kinds of things. And you mentioned pretty specifically, and your organization is pretty clear that you want to solve the problems. But do you have any feelings or musings on that subject?
Yeah, I mean, I get that question a lot. Yes, I've worked in big pharma. I worked in small biotech. Yeah, I mean, the nature of the pharmaceutical industry since its inception was to create treatments. And this is not saying, that there's no, unless they didn't show me it, there is no warehouse somewhere where the cures for everything are hidden. Right. The reason being is that the existing pharmaceutical industry never had the ability to create those cures in the first place. Why is this? Because the model of the pharmaceutical industry is to affect basically disease output. Everything you see when you go to pharmacy, when you are in a hospital, any of these drugs that you get today, with the sole exception of the antibiotic, work on the outputs of your disease, your blood pressure, your glucose levels, cell proliferation, what have you. These are the end products of disease. These are the outputs of disease. The true action, when you want to shut a disease down, which is a much more complex sort of intervention, you work upstream. And pharmaceutical industry, despite how much money they have and how good they are, what they do, never was good at that because they never did that. It's I joke a little bit. It's not like you're asking General Motors or Toyota or whoever to go from internal combustion engines to electric cars. It would be like asking them to build flying cars or something. It's really something that they are not set up today to do, because curing disease on the front end versus treating outputs of disease on the back end are two very different businesses. Mm-hmm. So, we've said, routinely, we believe probably if you're looking out, I can't really say 20 years, 30 years, there are going to be two different industries. There will be your traditional, maybe smaller pharmaceutical industry, a little more specialized in sort of the stuff that we do today in terms of output-based drugs. There's going to be a separate industry that's focused on disease processes, and that's sort of where we're going to sit in this game. And it's unfortunate that the industry evolved in that context, but it did. Mm-hmm. So hopefully we'll be able to choose it change it in the coming decades.
Mm-hmm. And you mentioned these two industries, the one of particular interest, the one in curing diseases and giving people a longer and a more sustained period of high quality of life. I think of the story that everyone tells also, Craig Ventnor and folks trying to wrap their heads around the Human Genome Project. And some people saying this is going to take an incredibly long time to even begin to get through this, but data science had advanced to such a degree that they were able to crunch those numbers a little more quickly. Do you see progress in data science being a big factor in the timeline for getting to something like a longevity escape velocity, something like a negligible senescence?
I think those tools are going to be useful, when it talks about artificial intelligence and machine learning and things like that. But once again, I think they're going to be more useful for the sort of the early stages of, say, drug discovery. At the end of the day, though, you still have to go into humans, which is the most expensive, critical part of the endeavor. Mm-hmm. And while I'm no expert in AI, everything that I read about it and sort of some of the foremost thinkers in it is it's still very difficult to mimic a human with a computer system. We are a little different. We are, although people may argue that the human body is just another machine, there are very few machines that can, with 50 trillion parts, as we possess currently, there's very few machines that can self-repair themselves. There are very few machines that can compartmentalize function. There's very few machines that could technically die and parts of the system keep running. So there's a difference between a machine and an organism. So some of these tools, I think, will be more niche than they're being portrayed. On the other side of that, we believe there is still a lot to learn from a systems perspective, because once again, this is everything we read in sort of our biology textbooks and so forth about A doing B yielding C. It's not the way the human body works. It's a little more complicated than that. And so some of the sort of the systems thinking that folks like the Institute for Systems Biology out in Seattle are really good at, I think that's going to be a great place, because that's where there's a tremendous amount of data that needs to come together, and it's really just at the very sort of beginning stages. But ultimately, I think these tools will definitely be useful at different components of the puzzle.
Mm-hmm. And that's interesting, because this just last weekend, I was at this longevity seminar and book signing with Newton Lee and Company, and one of the presenters there was Michael Rose, mm-hmm. and his talk was basically to some degree a critique of the SENS ideas and Aubrey de Grey ideas, saying that there's a little more to it than maybe just seven key interventions, something like this. But really interesting to be certainly everyone in this community, whatever their hope is for life extension, mm-hmm. we need to be talking about these things as much as we can, and using the appropriate scientific language. And that's not always the biggest goal there. I'd like to ask you something, and I'm almost, by way of setting this up, almost veering again into a sort of conspiracy notion, but I hope in doing so to then ask a serious-minded question.
Go for it.
Just about a week ago, a gentleman named David Koch passed away, a very wealthy man, worth about $40 billion. And the reason I mention this in this context is that I was in a chat room, and people were talking about reanimating this gentleman, keeping his brain alive. Brain in a jar talk, a conspiracy about this gentleman. It's sort of thing comes up whenever a wealthy person passes away, I suppose. But there have been some areas of interest in reanimation with things that have happened with pigs recently. Absolutely. And this is also an area that you have an awful lot of background and context that you could be providing. Tell us a little bit about the state of reanimation, how that might dovetail with other concerns, other interests like rejuvenation and negligible senescence.
Yeah, it's a great question, and obviously, as a company, we've been completely public that this is an interest of ours that we've taken baby steps in. It is a very interesting area. Just to lay the background for it, obviously, brain death or irreversible coma has been the accepted definition of death around the world since 1968, when it was defined as such, and till this day, it's been maintained as exactly that, an irreversible condition, hence the end of the line. However, quite a bit has happened in those 50 years. Namely, if you go into the literature, you will find dozens of cases, although none had a very great outcome, but you will find dozens of cases of brain death reversal documented primarily in the very young, primarily pointing to sort of the degree of neuroplasticity that exists in the very early stages of life. On top of that, you have, as you just mentioned, some of the newer things that we're finding. Obviously, the pig brain experiments at Yale. A couple of years ago, the discovery of the phenetotranscriptome research that basically shows, wow, after we die, thousands of genes, for some reason, pop to life inside our bodies, and they are embryonic and fetal genes, sort of, seemingly like the body is trying to have one rebirth of its own. We're learning a lot of things, combined with the fact that, it's 2019 now. It's not 1968 anymore, and the tools of regenerative biology and biotech have changed a lot. So putting that all together, combined with the fact that living cadaver research, basically using recently deceased subjects who still have beating hearts and breathing lungs for research purposes, which has gone on in the United States and around the world for decades now, very quietly. All of these factors point to that we probably in 2019 want to take another look at what it means to be alive and what it means to be dead. And if there are sort of baby steps that we can take in the research community to blur that line. And I think now's the best time of all to do it, because we have so much in front of us in terms of our knowledge, in terms of regenerative biology, in terms of the data from the last 50 years. And one other thing I forgot to mention, I mentioned earlier on the show, there are many species on this planet, I talked about them at the beginning, who lose substantial parts of their brains, in some cases, the entire brain, and they regenerate them, and they go on happily about their day. And if we can tap into some of these capabilities in humans, you see what it means beyond Alzheimer's, beyond Parkinson's, beyond traumatic brain injury. There are some amazing things that we can be doing. So yeah, reanimation is definitely on our list. It's not the main focus of our company, but it is indeed something that we are getting our feet wet in and really exploring what the research has to look like to get it done.
Mm-hmm. And in moving towards a longevity escape velocity, that is one of the major impediments, is that we don't have the best ways at this time to deal with those brain plaques, to deal with these neurodegenerative conditions. Some of the other things we might be a little bit better poised to have prototypes for dealing with senescence than in this particular area. Mm-hmm. So that is a serious area that it would be incredible to just be able to flip a switch genomically and be able to regenerate neurons in that way. That would be we work game changing.
Absolutely.
Absolutely. You mentioned problems with spinal injuries and the humans' inability to fix these things relative to other creatures. Some movement has been made there quite a bit over the years, and increasingly so. And it's something that people are sometimes wondering about when they're reading. You know, a lot of us techno optimists are pretty heavy consumers of technology news and medical news. And when we're reading something like a doctor in Italy saying that he's very close to doing a head transplant, people are saying, "Wow, that's a little bit surprising. I wonder if that's true." But we also see then legitimate medical research about fixing spinal injuries of this kind. What is your take? What is your take on the head transplant? Do you think that's something that's a reasonable stopgap as a life extension thing in coming years, or do you think that we'll completely be able to move around that?
At the end of the day, you know, from our company perspective, we sort of want to avoid that. So, I mean, if we could regenerate your body or regenerate and repair your spinal cord endogenously, or take care of whatever disease state you might be put in, that you would even get to the point where you were like, hey, you know, I'm gonna try to decapitate myself and see, you know, and throw the dice. Hopefully, there will be other measures that we will come up with before that. That being said, you know, I also have a small show that I host in this area, and I had Sergio Canavero on a couple of weeks ago. Look, I'm excited about anyone that thinks about these things and looks to shake things up and throw the sort of the ball into the wind against sort of the prevailing biomedical sort of dogma. We have to, you know, think back 100 years when we were doing the first organ transplants or the first cardiopulmonary resuscitation. And the fascinating thing, just, you know, now we're in the head transplant topic. I mean, the first head transplantations on dogs were done over 100 years ago now. And most people don't realize that. So this isn't, once again, you know, a new area. It's just that, you know, there are these areas that people, for one reason or another, they don't pan out in terms of whether they're funding or other research priorities. But a lot of this stuff has been happening for decades now. And, you know, I like at least to see that it comes back around, and that, you know, in the 2019 scenario, we're willing to take another look at it. So my hat off to him. I hope he succeeds. I don't, you know, I can't place a number on the odds, but, you know, I like seeing this type of work anyway.
Mm-hmm. Yeah, and you mentioned that this kind of technology in some nascent form does go back 100 years. There were Russian laboratories doing things along these lines, and they were publicized at that time, but they weren't widely embraced at that time. It brings to mind an idea of orphan technologies, where for something being viewed as grotesque, something being viewed as setting off a lot of other taboos. Sometimes we don't have quite the will to see some technology develop. Are there areas in emerging biomedicine that you feel are at risk of being too much an orphan technology, that you say, well, I wish people were more interested in this and not turned off by this, because we could really save a lot of lives if they weren't?
Yeah, I mean, there's a couple. It's a great question. I mean, one of them, and I'm happily seeing it reemerge. I mean, I point out that if you and I went in a time machine back, say, 100 years to a biology lab, what we would find, you know, this is before the gene era and DNA, we would find a lot of discussion. We'd see a lot of people studying organisms, whole organisms, but we'd see a lot of discussion that sound more like the terms of physics. Mm-hmm. They talked about forces and fields and waves and things of this nature back then. In came molecular biology and genes, and we forgot all about this stuff. But what we're realizing in the 21st century is genes by themselves don't do a damn thing. They just encode other, RNA and then ultimately proteins. By themselves, genes don't do a thing. There are higher level signals that come into play in determining what genes are expressed and what proteins are then created, and so how higher form is created. And so one of the areas that's extremely exciting, and a lot of it's happening at Tufts University, is that of bioelectricity. We are electric organisms. Our brain is full of electricity, our heart, our pancreas, our bones. Aside from the fact that we're biology and we're wet and warm and mushy, we have electricity flowing through our bodies, and that electricity does stuff. And it's very important in developing form and size and shape control of critical organs and tissues. And so there is an example of something that was studied 100 years ago. We threw it out the window because it sounded kind of silly then. And now it's coming back into play at places like Tufts University as being extremely important. And Mike Levin's lab was just funded by Paul Allen's group to tens of millions of dollars to investigate stuff. So that's pretty exciting. The other area I've always found very important, and you were mentioning Alzheimer's before, is just the whole area of the virome, and the fact that we have this preconceived idea that all viruses are bad. And yeah, they're pretty bad viruses with hepatitis and HIV and the common cold and influenza and things like that. But the truth is, the majority of viruses that make up our human system right now, as we're sitting here, are extremely good. And without them, we wouldn't have formed and evolved in the first place. So there's an extremely unique sort of symbiotic relationship between our bodies and viruses that integrate in our DNA. And so one extremely exciting topic, and when I did an interview on this a few weeks ago, is the concept in Alzheimer's disease, where we're throwing billions and billions of dollars at this amyloid plaque concept, failing miserably in the clinic. Yet there's researchers out there that are saying, you know what? This amyloid stuff might actually just be the body's response to viral infection in the brain. And if we can forget about it for a moment and basically look at the viral side and the virome and what's going on, there might be a much simpler way to deal with Alzheimer's disease. This is one I'm a little afraid is going to get, it's not going to get as much attention as it should be getting. So I try to get the word out about that. But yeah, I mean, there's a lot. There's a lot, and it's unfortunately an area that there's not infinity dollars for bioresearch. And things will get lost along the way, and hopefully not too many of the really important things.
Do you think that the lack of interest in the virome, is something to do with taboos about it being a bad sort of organism? Is it just that we don't quite have the language for discussing it, or scientists? There's just not that many researchers taking a strong interest in it. What?
I think, the first response you usually get is this, correlation is not causation. But damn it, you're finding lots of viruses in the brain. Probably you should take a look at this stuff. If you're looking at these cadavers, and if the beta amyloid stuff isn't working and the tau isn't working, maybe you should be looking a little upstream and not just brushing it off. And we've known, and once again, we have known for decades that amyloid is there for a purpose. Amyloid in the brain, we have amyloid in our brain when we're fetuses. It's why our brain develops in the first place. It is why neurons form in the first place. And yes, amyloid is one of the things that protects our brain during acute infection. So there's been this concept that we can, it's more sort of old school pharma thinking that there's the thing, it's bad, let's get it out of here. And it doesn't work in the clinic. And what do? We throw more billions of dollars at it in the clinic to try to make it work. Not always the best thing to do. We really need to sort of not be afraid of looking at possibly, there may be a lot of simpler paths to some of these problems.
It brings to mind also the analogy that we were talking about a little bit before of the Human Genome Project. They managed to slog through all of that data, but at that point, and really very much at this point, they basically just had written out the alphabet and not really made a great deal of understanding of what it all meant. It's an exciting prospect every time some new discovery or development therein is made. Speaking of which, about 2 months ago, George Church published a piece talking about some specific genetic markers for achieving longevity, and also for human upgrading. A few of those, also kind of mentioning sort of something like superpowers. Do you have ideas about a timeline or these specific kinds of interventions? What are my chances? I'm a poor guy. What are my chances for being able to start to have some longevity interventions in the coming years or decades?
I think your chances are really good in the next decade, 15 years. I don't think, and I'm I don't want to get in a fight with George Church. I would totally respect him. I don't think from a wallet perspective, uh, and a regulatory perspective, we were talking about, dozens of genes for as I remember that being. I don't think that's going to be your path. That may be your path 30 years from now. I don't know. But from what I do know about sort of regulations of gene therapy and the way sort of the system works, even one gene is, a difficult process. If you're talking about 45, it'd be wonderful if we lived in a world where the FDA and EMA and so forth weren't what they are, but they are. And so I think those things, namely the cost of that type of therapy plus the regulations around it, are going to push it out. I think where we're going to be finding the short-term opportunities are with the older technologies, such as, not to promote our own stuff, but some of the things that we're developing, some of the things that are a bit more fit into existing regulatory schemes, and work off, once again, data that we've known about for decades now that finally, just because, aging wasn't an exciting target, got forgotten, whether they're things like metformin and rapamycin or some of the parabiosis research. Some of these shorter term tools, existing tools, I think are going to be the more rapid path towards the initial translation in humans that will be cost effective for you as well.
Mm-hmm. Very nice. It also some of this discussion also brings to mind a notion which is basically a party doctrine in the United States Transhumanist Party, and I think honestly you have been aware of that and a part of that discussion at a time when I only had the vaguest inkling of some of these notions, to be perfectly honest. But talking specifically about a more robust right to try. This is in the charter documents of the USTP. And how do you think we balance streamlining, getting these new interventions to market, saving as many lives as possible through those channels, versus consumer protection necessaries that it would be maybe in other areas? But how do we find a good balance in all of that?
I think we look at what the rest of the world's doing. We have a very hyper-regulated system here in the U.S. You look abroad, you see conditional approvals of stem cell therapies in Japan. You see what's going on in China with their free zone activity. And the world, fifth largest drug company in the world, Merck, just set up on this Hainan Island resort area where God forbid you're dying of cancer. You now have the ability to go and try some of these monoclonal antibodies at your own risk. So other countries are doing things. At the same time, you have some of the other places, a little off the beaten track, but places like Thailand, Turkey, Panama, where the basis of they're building medical tourism as a major component of their economies, and they're going steps ahead of where we are. So we as a country are going to have to get in line with some of this. Expanded access, good. Right to try, a little better. But some of these other countries are really leapfrogging us. And I don't forget what the number is on medical travel nowadays. It's $75-80 billion a year. It's not a joke anymore. It's not a niche business for cheap breast implants and dental work. I mean, people are traveling all over the place for cutting edge therapies that are not available in their home countries. And it's ultimately going to, I think that's a very exciting industry that is going to blossom even further as more of these exotic tools come slowly but surely closer to the clinic, but are just stagnating on the U.S. front.
Mm-hmm. Yeah, and
I've always been one that's erred a little towards, been a little more liberal in this area. I mean, it's great, if you want to see something coming through phase 2, that's all well and good. But at the end of the day, the truth is, from a pharmacogenetic and a toxicogenetic perspective, all of us are, are diseases of one. My diabetes is always going to be slightly different from yours. My cancer is always going to be slightly different from yours. And, taking that into account, there is something to be said for the N of one clinical trial. And we have to keep that in mind because that stuff is not explored at all by existing pharma model.
Yeah. That personalized medicine is not something that is really a feasible thing in the 20th century model of research of this kind. And the United States, for whatever ways we might critique in terms of regulatory concerns, in terms of being able to get the maximum amount of these products to citizens at a reasonable price point, the United States has very much been at the forefront of developing these things. And there's a lot of costs and front end associated with that. It's interesting to have the this idea, and I don't think this was something in the pre-CRISPR era that was really thought of in the same way that it is now. We now think of the idea of senolytics and personalized medicine. These are real things, and increasingly so. It's quite incredible. So you were on the World Economic Forum's Human Enhancement Council. What kind of things can I hope for in terms of enhancements? In terms of what do you see happening? Let's talk about some interesting or fun stuff too.
I mean, look, I'm on the record for believing that that all forms of, at the basis, all forms of complex, higher order regeneration in 3D critical organ systems is going to be totally achievable in the next 10 to 15 years. Spinal cord, heart, kidneys, liver, brain, pancreas, you name it. So everything goes our way, the way this is all going to turn out. We're going to have a lot of money left over that we're currently spending on just treating these things and prolonging life by a couple months, really changing the spectrum. When it comes to some of the human enhancement stuff, I believe that, obviously I get asked the question because, for instance, there are quite a few very interesting, we love nature, we love studying non-human, superhuman organisms, but there are a few organisms out there that are extremely, for instance, radiation resistant, and this is something that obviously, if we want to go beyond this world, whether that's to Mars or beyond, we're going to have to really get that in order, because space, while there's a lot of it out there, it's full of a lot of nasty cosmic radiation and other stuff, and that's one thing that we're going to have to be cognizant of. And we're really, once again, whether it's the Deinococcus radiodurans and its ability to reassemble its shattered genome, or whether it's something like the tardigrade, which can go into a state of suspended animation for years at a time, we're really going to study these from a biologic perspective and understand, once again, how they do it and how we can ultimately do it. I'm not personally very keen on sort of, genetically engineering eye color or anything of that nature. That's or super babies, anything like that. I've always been very interested in the biomaterial side, whether that's things like spider silk for extremely strong fabrics, which has been going on for the last several years. I don't know if commercializable products have gotten there yet. And then also some fascinating research, and it's happening actually here in Philadelphia and Delaware, in terms of liquid breathing technologies. If you think the abyss, and once again going back to sort of that fetal condition, we did breathe liquid at one point, and it's a matter of sort of trying to recapitulate that with technologies for premature infants, things of that nature. There's a lot of amazing stuff. I mean, I could go on for hours talking about this. There's a lot of things that we're going to be capable of in the coming years.
It seems like that particular kind of gene therapy and other sets of interventions that would allow you to breathe liquid, it's a little bit simpler than some of these other things of of turning our species into a lot of extremophiles or things that could survive off world. But that would be some hell of a thing to try.
Yeah.
And it's always a question of like, how invasive is this? How reversible is this? How feasible is this as a therapy? That's not something that has a lot of risk associated with it. It's really it's really interesting.
It's a point. You have to remember too, though. Once again, going back to this, and which I love, a healthy respect for nature, healthy respect for evolution. But keep in mind that you, me, everyone listening to this, we all had gills, we all had webbed feet, we all had tails in our mother for those 9 months.
Not that long ago.
Not that long ago. So, we have to think, we're human, but remember, our genome did not fall from the sky. It came from the genome before us. And so, there's a lot of really interesting ways to look at this beyond sort of, we're human and everything else is alien. No, not necessarily.
Yeah. That is a feature of a humanistic fallacy, an idea that that there's something particularly magical about a human relative to other creatures, and that relationship it's a little more nuanced than that. Well, are there any kind of, you have an incredible set of insights into developing all kinds of businesses in pharma and emerging biomedicines. Are there any specific types of startups, types of biotech companies that you think, man, I want to keep my eye on this particular subset of this marketplace?
Well, I think, and this is more from a, once again, going back to the 7 billion people that are on this planet with us, and that we need to think beyond, a handful that. A lot of these tools that are coming down the pipeline are extremely expensive, whether it's gene therapy, whether it's gene editing, whether it's some of the complex antibodies and other therapies. However, I was in plant biotechnology 15 years ago. These tools have been out here. We still haven't totally taken advantage of genetic engineering in the plant kingdom to produce some of these things for extremely cheap prices. And whether that is, the banana tree that produces the malaria vaccine, or the spinach that produces the monoclonal antibody for your cancer, there is a wonderful bioproduction resource out there that is very good at making therapeutic proteins and other moieties, called the plant kingdom, which been here a billion years, and is really good at doing this stuff. Much, when you look at the costs of some of these factories they're putting up now for single products, $750 million, $1 billion a pop. We have to change that dynamic in order to get products like these to the masses. And so plant biotechnology is always something, I'm not, not involved in it now, but always been near and dear to my heart, and something that I think we all need to keep a lookout for. And then the other has been, it's extremely fascinating, and I guess you can lump the microbiome and virome work into it, but it's what we'll call the living bioproducts. A lot of people don't realize that both leeches and maggots, are FDA approved in the United States for wound healing purposes. Live organisms. George Washington goes back to George Washington and all this stuff. There is, once again, a very unique niche that's happening quietly, but there's regulations out there. FDA oversees it. It happens. There is a mystery, what we'll call sort of this biosemiotic communication between humans and other living organisms beyond the microbiome that exists. That, once again, not a popular area, not very hot. The products that are there, they're there and they're making their money. But I think there's a tremendous amount still to be learned about how we as humans interact with the 9 million other species that are on this planet. And biologically can learn from them via, we'll call this biosemiotic communication between our genome and theirs. So these are two areas that interest me. They're probably a little off the mainstream, but they're really cool, and I think there's something we should probably keep an eye on.
Yeah, that's fascinating. last night I interviewed a clever young man named Daniel Yelishvili, and we were talking. He was talking about his chapter in this book about geoengineering, but we also talked a little bit about life sciences, and I'd love to get your opinion on this ideas of bioremediation in areas like the damage that we've done to our oceans. There's some biomechanical science for microbes that are cleaning things, and generally talking, because these existential risks that we have now derive from technology. Climate crisis derives from our use of and overuse of certain kinds of technology. Many of the existential risks that we might face in the future might also derive from advanced technology. Thinking specifically of bioremediation and designs of this kind, can we fix the problems that we've created? Are you hopeful that we're in a good position to do this? Do we need to be doing? Is this something like an area where we may have some orphan technologies and lack of consensus that we need to advance a lot more to be able to address this?
I think it's just up to the will and the people putting money behind it. I mean, obviously, we have organisms on this planet that can digest plastic. We have organisms on this planet that can digest nuclear waste. I had some time in the industry of phytoremediation, basically planting these hyper-accumulating sunflowers to suck waste and other nasty chemicals out of the earth. Yeah, I mean, look, the planet's been here a lot longer than we have. It has its own technologies, let's say, built in to take care of some of this stuff, even the weird things like plastic, which we came along and made. So I have no doubt that the solutions are here already. And I can't say whether it's this fungus or that microbe or this plant that will do it, but clearly evolution has put these organisms here to do these things, and they should be taken advantage of.
Yeah, and I think the idea that ecosystems will endure is a good one. The idea that humans will be poised to continue to live in those ecosystems is more of an open question. But I do think that we are. I'm hopeful. I'm hopeful that we'll be able to find solutions and are finding solutions to these problems. But yes, it is something that people, some people that I speak to, not necessarily people who are techno optimists. It's almost not an optimistic position by definition. They've given up. They feel that the human race and life on Earth is coming to an end. There's a kind of apocalyptic worldview in some of this from people who would be regarded otherwise as liberals or pretty reasonably science-minded people, but they have what I think is a mental block around the idea that alarmism around what humans have done on this planet and where we're going with that. I find that very concerning that this is so commonplace, because it doesn't help in bringing up a new generation of citizen scientists. We touched upon the idea a little bit of citizen science before and biohacking. Do you think that on the whole, this is something that advances scientism in a civilization? Do you think that it can even advance specific industries, or do you think that it's something that's just more of something of fun that people are doing?
I definitely think it's part of the equation. I mean, just look, if you look back to, I'm trying to remember the year, probably have it on my computer somewhere here, but if you think back to the experiments that were done by, Nobel Prize winner Barry Marshall and his pioneering work in discovering that, hey, this ulcer stuff is probably not stress, it's probably not spicy food, it's probably not too much acid, but there may be this bacteria, and hey, I'm just going to go drink some and I'll figure it out. I mean, I think that was the first modern biohacking, and bing, the guy got the Nobel Prize and came up with a totally new solution for this billion-dollar space of peptic ulcers. Yeah, biohacking has its place. I mean, I don't know, and I don't, let's speak out loud, I don't know if, genetic engineering in your garage makes the most sense, but, that's for other people to figure that one out.
Mm.
But I do believe that, look, we have a lot of smart people on this planet. There's more information in front of us than ever before. It's up to people to try things and see what works. And we are, as I said, we are little clinical trials of one, all walking around. And while we all, we're all humans and we all kind of look the same, our genomes are pretty much the same. How those genomes are ultimately expressed vary amongst the 7 billion of us, and we're all little clinical trials. So I have no problem with biohacking, as long as it's intelligent biohacking.
Mm-hmm. I'm reminded of a podcast that I did with Liz Parrish, who was willing to be sort of patient zero in that way. If you look at the annals of scientific history, a lot of people who were then legitimized by having received a Nobel Prize or some award, they started out kind of with a certain degree of self-experimentation and at least a willingness to put themselves out there a little bit and take some risks, and then kind of they were rewarded in their successes and in the final accounting of it all. Mm-hmm. It's interesting, in talking about biohacking, because there are some existential risks which can derive from this specifically. For example, I'm not a great fan of Patriot Act type surveillance and things of this kind, but I'm also concerned that the price point has come down for someone to inadvertently, or some troubled bad actor, to do this as well, to create something, a doomsday bioweapon in their garage at a very low price point. This was something that was this is the sole province of well-heeled nation states with sophisticated labs only a few decades ago. Now it's become something that anyone can do if we don't have some kind of surveillance or some kind of surveillance mechanism to keep tabs on everyone. We could see someone stumbling into kind of creating something quite awful and quite disruptive. Am I being? Do you think I'm being alarmist on that? Is that?
No, that's scary, and you're right. And it reminds me, every couple of years, somebody does an article. I forget where I saw it on what used to be, it was Russia's biowarfare thing. It had some Russian name, but it eventually became the Vector Organization, became a vaccine company. And every now and then someone will do an article, you have to go on the internet, about, hey, they still have this facility here and it still has all these weird samples of smallpox and other strange chimeras that they were making back in the Cold War. Yeah, it's, let's just say, I hope these facilities are really under wraps.
Yeah.
Because, who knows? But then at the same time, you see, a couple of weeks ago, these human monkey chimera experiments were approved for the first time in China. It's that sort of that borderline between the species that are kind of close, because that's where the stuff jumps, right? It doesn't happen between, you never get a virus from eating sushi. Fish and humans are, evolutionarily pretty far apart. But when you start playing with these species that are really close to one another, that's where stuff has gone wrong in the past, or that's where sort of evolution or the co-evolution of man and viruses has not sort of, gone the full cycle to protect us. And so, got to be wary about some of these things. And as I said, I hope the powers that be in these places and that are doing this research really have the biocontainment capabilities that they need on their apps. So.
I think any discussion of this type of chimera, maybe it's a reasonable segue to talk about uplifting of creatures. This is something that's discussed in transhumanist circles. Maybe it's a little more speculative. But I'm reminded this is an AI prospect, but a very real prospect. Elon Musk, just some weeks ago, did a presentation on this Neuralace technology, and revealed at that time that there is a monkey that has a Neuralace rig attached to him. So this monkey is able to be doing things on a computer experiences I'm not able to be doing, and that is effectively an uplifted creature as a result, able to be communicating. In ways that other creatures of this kind are not. Is this something? Is this something that you think we should be doing? Obviously, I think we'd probably be pretty well in agreement that almost all of these money should be spent on bettering the human condition. But do you have reservations about this sort of thing, or do you say let the chips fall where they may?
I've actually, I'm not really opposed to it. I've been very, I've been more interested in more from a science fiction perspective because a lot of this stuff, and I don't want to speak out of line in terms of mind uploading and some of these other more futuristic things that I'm, by no means the appropriate person to talk about. But the one thing that always comes to mind with these transferring of information and so forth is not as much sort of can we make the chimp more intelligent, but is there some way to actually transfer memory or mind to another organism? And the reason I bring that up, and I don't know, once again, in one of these things, people forget, or maybe people never knew, but back in the late 60s, early 70s, there was this wonderful set of experiments done, and a book was written on it called Shuffle Brain by Professor Paul Piche at University of Indiana, where he was basically moving brains and part of brains around between frogs and salamanders and making these things, and toads, and making things called tatamanders and all these weird combinations, and was able to change feeding patterns and memories and sucking out certain proteins from the frog and injecting it into the salamander. So a lot of this kind of stuff has happened on other species. Is there a benefit to making a chimp more intelligent? I don't know. I just, I've sat back and wondered, could you, in the context of the uploading that people always talk about, instead of putting myself into the computer, which I'm not very interested, is there a way to technically transfer yourself to a monkey for a little while and then back into another brain? Who knows? But that's my science fiction notion for the night, and then I'll stop there.
Well, there are people who are working on these cyborgization kind of efforts of different kinds, and that is a thing that Dmitry Istov and Ray Kurzweil and different people are very interested in. So it is speculative, but who knows what this landscape looks like in 15, 25 years. It's a very, very real possibility of kind of those transfer experiences. I would like
I'm on the record for I like being carbon based, but who knows? I know people like silicon better. I want to try to be as carbon based as possible.
Yeah. And I think the SENS approach to life extension is also just, and a broader negligible senescence approach is the more realistic thing. And also just people in thinking about these ideas of becoming a machine in this way. Maybe there's workarounds in the long term, but a human being is very much driven by these physical impulses, by the hormones. By these things are defining us. If we were able to reverse or engineer the mind in that way at this time, we wouldn't be having those experiences. It would be something else. I spoke about the disembodied pig brains, and people have said much the same thing, that reanimation, the experience would be substantively different from. So different that we would say, this is not you anymore, something like that. I do want to ask you something. This is a very small question in the grand scheme of things,
sure, and
almost completely an aside. But you were on a podcast called "Before the First Cup with Jules."
Okay.
Do you recall having done that one?
I remember that show. I don't remember what I talked about because I did like 100 of them in the course of. But go ahead.
Well, she was Jules was somebody. She's not doing her podcast anymore, and she's someone who was an interesting case because she has a high degree of scientific literacy, but she's kind of a technophobe and very concerned about a lot of these things. I was just wondering how you met her. Because she's an anti-transhumanist, and I used to listen to her show a lot because if you could filter out the anti-transhumanism stuff, she was basically doing an hour-long rundown of companies' R&D in AI or the life sciences every day. So it's kind of a valuable resource. But I was just wondering how you guys connected, because she was maybe just a different kind of character.
I don't. I really. I have to go back and listen to the show. I do not remember. I do know that there was a period about a year and a half ago where I was literally doing a podcast a day.
Mhm.
A lot of people were interested in the whole Reanima stuff. I have to listen to it. I just don't remember.
Yeah, yeah. She was it was just, I thought it was a real boss move that you went on that show because I think most people would have just been like, wow, that's a strange person. And to be fair to her, she wasn't like some other anti-transhumanists, talking about the devil or playing spooky music and stuff. She did come at it from a scientific perspective, but she was kind of very much a bio-Luddite, and I was just curious.
I'll listen to it again. I'll let you know. I just don't remember.
Yeah. Well, so I think I feel that we are moving from this sort of a transhumanist, a preliminary era, into a transhuman era. Maybe we don't always have a precise timeline for that. We talk about cyborgization, we talk about the longevity, escape velocity, and things of this kind. But it's incredible to talk to someone like yourself who's really been at the vanguard of some of this. Do you have any final message for us about regeneration, about a negligible senescence? Any rallying cry for people and how they should be thinking about these things or what they should be doing? What are we doing wrong as a society?
Yeah, I mean the main. But look, I believe that nothing is off the table as far as the future is concerned. As I said before, the literature is full of both current and historical yet forgotten information about how nature has already provided elegant solutions to most of these problems that may seem insurmountable today. It's just a matter of going after them. We cannot afford to think inside the box and fall into the sort of the old traps of the traditional pharmaceutical industry and its regulators and the sort of the century-old model that they followed. If we follow that path, we're not going to get anywhere. There is a reason that microbes and plants and invertebrates and amphibians and so forth have survived on this planet for billions of years very happily and developed their own answers to all the things that are killing us left and right. So I believe the future is very bright. As I say in the book, nature's transhumanists have already discovered these answers. We just have to follow their lead. The one thing that we can't do, and I try to point this out when I go to conferences or whatever, there's a lot of, especially on the sort of the radical longevity front nowadays. I come out of the pharma industry, and even in the pharma industry, we didn't fight that much. The cardiovascular team wanted a little more money than the neurology team and so forth. But at the end of the day, we didn't want to step on each other's feet. There's a little bit of that going on right now in the longevity community, where sort of little camps are being created. We can't have that because that could implode the whole thing. So we really have to try to avoid the infighting that I think, unfortunately, in social media and elsewhere goes on a little too much. This person's stuff is stupid. This person's an idiot. This will never work. Blah, 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 blah. We got to get away from that. It doesn't help. Everything is going to be important to be on the table. There's not going to be a single magic bullet, as the drug industry refers to it, on this stuff. It's going to require complex combinatorial interventions of many of these tools that you hear about on a daily basis, whether it's SENS, whether it's Michael Rose's evolutionary approaches, whether it's biohacking. A lot of it's going to have to come together to make it work. So we can't knock each other down. But at the end of the day, I'm very positive about the next 10, 15 years.
It came up, I was a little at a loss as how to address it in the moment. It came up in the second debate, the idea of public subsidies, public funds for cryonics. And I would staunchly defend anyone's right to use this in the private sector. That it's not a proven technology, but breakthroughs have already been made, and we can expect that more will be made, so that people will be able to benefit from this service that they purchased. We should hope so. But the idea that we should spend an awful lot of money publicly funding this, when such a sum could maybe equivalent sum could result in 30 other interventions that would have better outcomes for life extension. I was kind of shocked that people were some other candidates were so interested in spending public money or making a focus on this technology as much as I do support its current use. And that brings to mind a final question. In talking about life extension generally, this cryonics is expensive. I interviewed Rudy Hoffman in Florida, who's helped a lot of people find ways to fund this, through other channels, with their estate and life insurance and so forth. But some people look at this concept of longevity escape velocity, and I would say this related concept of a universal longevity escape velocity, and they say it doesn't mean that much to me if Ray Kurzweil or Peter Thiel. Ray Kurzweil says as of 2020 he believes he has effectively reversed. He's effectively reached a longevity escape velocity. But they would say if relatively few other people on Earth are able to benefit from this, I'm of the mind that these two things will follow each other very quickly. But not everyone is convinced of this. How do you think we could set people's mind at ease that this good work will be done in a timely fashion?
In terms of cryonics?
No, not cryonics specifically. In terms of negligible senescence for all, in terms of universal longevity escape velocity, not just being for Ray Kurzweil or Peter Thiel or somebody who has $1 billion to throw at the problem for them personally.
I think what's going to put most people's mind at ease, and I know this is probably not the best answer, but is to see a critical mass of pharma companies taking the technology through the final stages of development. So, at the end of the day, the large-scale clinical trials of these materials, not the small biohacking N of ones, but the hundreds of patients, the thousands of patients required in the large-scale clinical trials, funded, and the only people that have the guns to do this, it's not Peter Thiel, it's not Bill Gates, it's Big Pharma that has that $200 billion budget every year for R&D. It's having some of the big pharma companies buy into these tools and take it the final length of the race. It's great to see, some of these companies, raise their $200 million in venture capital and finish their preclinical experiments. But at the end of the day, when pharma gets in, and there's this lemming effect, once Pfizer gets in, then Merck gets in, then Roche gets in, then Novartis gets in, and it becomes an industry and it becomes a real thing that is going to not just have them pushing stuff across the finish line, but then putting the hundreds of $millions behind the distribution and the manufacturing and everything that's required to get it to the masses. So I think that's going to be the real inflection point. And it'll happen. It's just, once again, it's just a matter of a critical mass of these tools to the licensable, transferable stage where these companies pick the stuff up. But it has to look good. You can't have crappy data and expect, the big guys to get involved. So I think, and that's one thing I've always been saying. I'm not a very big fan of sort of these conglomerate investment models where we're going to throw tons of money at 15 different tools. Develop one. Get it across the finish line. Get it across the finish line. And so here is one piece of longevity escape velocity pharmacotherapeutic intervention. Bing, it's on the shelf. It's available to 100 million people in the United States that need it. Then we're real. And it'll happen. It'll happen.
One last thought. It's something that I've spoken to a few people in different podcasts, and I'm always trying to see if people think that this notion passes the lab test. Something I spoke to Paul Spiegel about. He has a lot of interest in this area. I spoke to Florian Marcus, the Estonia e-governance emissary about this. And the thing of Estonia is they've really done a lot to digitalize many features of governance, and therefore their civil society. They have a lot of e-service portals, and in raising the bar over the years, now they're at the point. It's a small country. They have good, by the standards of today, quite good public health outcomes. And this level of digitalization, now they're maybe able to start having a public health service that does shift from end of life to preventative measures by using data science and digitalization, by having a constant oversight of citizens. Is this idea that we could be doing this in some sort of public health initiative or public-private partnership? Is this science fiction? Is this wishful thinking? Do you think that this is something that countries could be doing? I also think that maybe a small country doing this, and suddenly you say, yes, this country is now a country of immortalists. Everyone here is doing this, and it forces everyone else to say we have to look at what we're doing with our public health service and outcomes.
Yeah, I think it's realistic as you say, when it comes to some niche players that are out there. I have a show coming up actually in a couple of weeks with the ambassador, UN ambassador from Costa Rica. And here is a country where they've made sort of not just medical tourism, ecotourism, health travel. Their whole theme now is sort of health and longevity. So I think sort of that model, wrapping, as you were mentioning, sort of the E component to it, in a environment where you have more flexibility to change the economic model. Absolutely. I don't know how quickly it can happen here, but yeah.
We have some areas where we want to have some other public health benchmarks being met sooner before we can start to do some of that. And there's differing concerns in different countries of these kinds, certainly. Thank you again, Ira. This has been wonderful to talk to you. Really incredible insights. I hope we get a chance to do this again sometime. It's just been really, really fun for me. Thanks again for doing this.
Absolutely. It was a great time.